what's up, y'all? Welcome back to the channel. This is Eric, not a real doc, DPT, and it's been a minute since I've been doing this last. We've had several things going on with our family and with my job and everything that has kind of prevented me from being able to do this as consistently as I was planning to. But Lord willing, this new year we'll start off and we'll be able to get broadcasting here um, more regularly and trying to pursue the vision that I've had for this channel and that I'm trying to create with it. So I don't know. So we'll see. So anyway, well, so today's video we're going to continue the series that have been working on or was working on, which is helping patients. I came up with the idea that patients may have a question about what is it like on the very first appointment, whether that's in an outpatient setting or whether that's in home health. And so today we're going to be talking about what it's like for um, a patient when they experience their very first session with their physical therapist in an acute care setting. So that's going to be in a hospital setting. So for patients that are in the hospital, they are obviously not going to need a referral from a physician. That order has already come over from the physicians that are on staff at the hospital. And when the PT comes in, they will first have looked at your medical records and have done a review of your medical chart to see, why are you in the hospital? You may be seeing this physical therapist, by the way, in the emergency room. You may be seeing this physical therapist after a surgery. It could be when you go onto the floor after being admitted for a variety of different conditions related to your health. So physical therapists will work pretty much anywhere in the hospital setting, depending on the type of hospital that you are located in. When the PT comes in, as I said, we will have already reviewed your medical chart and we'll be have a good idea as to why you're actually there with us in the hospital. And then we are going to, even though we have reviewed your medical chart, we're still going to talk to you when we first come in, kind of introducing ourselves, finding out, what it is that you say that you are in for. And we'll kind of take a brief walk through your history at that point and seeing how we'll be able to shape your goals so that they are meeting a lot of your own personal goals as well. So that's going to happen in probably the first like 5 to 10 minutes of your physical therapy evaluation on that very first appointment, or not appointment, but that very first day. That should also be noted. There's not necessarily going to be an appointment time for when PTs are going to come and see you in the hospital settings. Usually, the PTs are going to come out and try to do their evals first thing in the morning. And then if they have any treatment visits or anything like that in the second part of the day, they'll try to do those on the latter part of the day. But it's not a hard and fast rule, but for the most part, we're going to try to get the evals taken care of in the morning. We will be coming by your room. We'll drop by if you're eating breakfast or something like that. Then usually the PTs will be nice and say, okay, hey, let me go to another patient, and then we'll come back to see you later in the morning, maybe after you've eaten breakfast. Then when we go through, when we come back, after we've talked with you about your history, as I mentioned just a few minutes ago, then we will start our testing procedure. Usually that's going to be first looking at your strength. What's the strength of your legs? What's the strength of your arms? Doing different manual muscle tests at that point. Usually that will be at the side of your bed. And so at that point, we're also able to kind of assess what your balance is like. For how good a trunk control do you have, and then that gives us an idea of where we're going to be going with you. After we've done that manual muscle testing, then we're going to look to have you stand. So we usually will have walkers with us if you don't already have one of those in your room, and then we'll have you stand if you need a if we're concerned about your balance, then we'll put a gait belt on you. So that gait belt is going to go around your waist and will give us a point of contact for us to hold you around your center mass so that we can help prevent you from having any falls. So then we'll have you stand up. Usually we'll look at your balance at that point, just how well are you able to stand? Do you have good muscle control at your legs? The how well are you able to just stabilize yourself? If you are in the ICU and that's happening, which yes, PTs, we will see patients in the ICU. Those are patients that have all sorts of lines and leads that they are attached to, and so the PT will have already gotten all the cords in place, and maybe we've already talked to the nurse and they've already come out and unhooked you from some of the lines that allow us to make you a little bit more mobile. um, Also, I should step back and say the usually in the acute care setting, we're not always taking your vital signs. We're usually not taking blood pressures or anything like that. Although, if you are in a setting like the ICU and you're hooked up to any monitors, we will be looking at, what is your heart rate doing? What is, what are things? What are some of the values on those monitors for you? And then that will also help to assess whether or not we can actually get you up and move, or whether or not we will just be sitting at the side of the bed and then maybe have you get in the back in the bed after that. A lot of that also will come from talking to your nurse before we come out and see you, especially on the ICU. We are going to talk to a nurse at the nursing station to find out, okay, what is it that we can actually do with you, because they are certainly going to be the leads as far as um, your medical care is concerned. So once we've got you standing up, and whether that's with a gait belt or not, then we'll try to have you walk. Usually it will be at least within the room. If it seems like you're pretty strong, then maybe we will take you out into the hallway. At the very least, we would try to walk you over to the recliner that is typically in your room, because it is much better if we can get you up and sitting in a recliner and a chair, as opposed to having you just lie in the bed all day. Lying in the hospital beds can be really bad for you, because your hospital bed will tend to suck you into the bed itself, and it's just it just really makes it hard for us to progress you. I mean, say this to patients oftentimes, that lying in the bed will beget lying in the bed, which begets lying in the bed, which begets lying in the bed. So you can see kind of where that leads. So we try to get you up so that you are in the recliner. Another benefit of being up in a recliner is that your lungs actually are designed to function against gravity. So when you're lying in the bed, it's really hard to develop a good productive cough. So we're trying to get you up and into your recliner, and get you spending most of your time sitting, so that way you have a better chance of developing a productive cough to make sure that you don't develop pneumonia in the hospital. And really, for a lot of patients, that really is the number one thing that physical therapists are doing in the hospital, is actually just trying to prevent pneumonia, because that can affect so many patients and can be detrimental to their progress in the hospital. So um, usually physical therapy teams that's one of their primary purposes in the hospital. Also, of course, we're looking at the safety of how you're able to do everything in the room, and making sure that you can move around safely. Then we may talk to the nurse after that and tell them, give them some ideas or give them some pointers as far as what you should be doing to or what they should be doing to help you prevent having any falls. Um, this there's everything that I've said so far are typically would be typical of patients, as I said, that are in the ICU, typical patients that are on the floor in a general um, uh, and on a general floor that's seeing a variety of medical cases. Also, it would be pretty typical of post-surgical heart patients. Some things, those types of patients would fall in that same kind of general format. The type of patients that would receive a little bit different part of, or a little bit different care would be the orthopedic patients. So usually in the hospital there is a floor that is entirely orthopedic based. That is my favorite floor that's in the hospital. I really enjoy working with those patients. But for that type of a patient, usually the biggest issue with patients that are orthopedic patients, these are going to be your patients that have had knee replacements, patients that have had hip replacements. The thing with those types of patients is they truly don't know how to move. So maybe they've had this knee replacement, and now when they first wake up, the PTs are going to come in, and we're going to be showing, we're going to be trying to get that patient up, which a lot of time patients are very hesitant to do that. They're very scared to do that. They don't know, can they trust the knee or the hip that has now just been installed. But the best thing for patients in those settings is early mobility, early ambulation. So we want to get you up and move. So in the orthopedic floor, when we first come in, as I said, as everything would still be applicable in that we would still have already previously reviewed your chart, found out when your surgery was, looked at your medical history, kind of get an idea of all of that. We'll come in and briefly kind of again review things with you as well, and kind of see overall how you're doing, what your pain levels are like, that kind of a thing. Then we will well, d- depending on the PT, you might have some different ways to kind of go about doing the same thing. But I would, in general, try to get the patient sitting at the side of the bed first. And then we're going to see, like, okay, well, again, looking at trunk stability, how well are they able, are they able to tolerate that kind of movement? Sometimes the patient might feel sick at that point because of all the different medications and to a variety of factors. Sometimes there's anxiety about moving and stuff, and so I like to generally sit at the bed first, because if your patient is going to be sick, well, hey, great time to do it is then. I usually before I've already done that, I've already generally made sure I know where the trash can is so that I can quickly grab that if need be. Um, and then, as I say, we would proceed to look at your manual muscle testing. Then looking at like that knee joint. Hey, what can you do as far as moving that knee goes? Then I am going to at that point have you stand. We'd stand to a walker that you would have already been issued, and seeing again what your balance is like, how well you're able to control the muscles in your legs, how stable you are. Then we will proceed to then walk around the room, and then we're going to go back, and generally I might rotate that person back to either the bed or the recliner, and then we're going to work on some range of motion work on the actual knee itself, and actually having you starting to do some heel slides, starting to do some things where you're actually bending the knee a little bit. Same thing, actually, if you had a hip replacement, we're going to start bending your knee as well so that your hip will flex. And everything basically in the ortho floor is designed around early mobility, getting those joints that were worked on moving, but safe, in a safe and functional way, and not pushing. Also, it should be said, this wouldn't be pushing patients to pain tolerance or anything like that. This would be trying to work at a low intensity, trying to work within the range that the patient can tolerate well. Because when you just came out of a surgery, the last thing we're wanting to do is find out, okay, what are your max tolerance levels? That's not at all what we're trying to do. We're more concerned about your safety. We're more concerned that the joint that has been repaired and worked upon actually is stable, that it can tolerate functional movement, and that we can get you up and have you move around safely. Because once you can do all that, then you can make that transition to home, or you can make that transition to a skilled nursing facility where they can give you kind of more care. So that's it. That is in general what is going to happen on that very first appointment as far as the evaluation from the physical therapist in a hospital setting. Usually, the visits that would happen after that are done by the PTA, and then we, as the PTs, we may or may not see the patient after that. It's one of the weird things about working in a hospital is a lot of times you'll do these evaluations on patients, and then maybe you set up the plan of care for the physical therapy assistant to come in and work with that patient, and then that patient then may get discharged and go home before you're ever able to see them again. So we don't see a lot of progression in the hospital. Occasionally you do if you have those patients that maybe stay in longer term, but usually patients are in and out before you're able to really do a follow-up visit with them as the physical therapist. And so it's it's a little bit of a different environment in that you're more concerned with immediate safety, immediate function, immediate strength and balance, but we don't get the to observe that progression from that very often. So it's a little bit of a unique setting to work in. So that is what you should think of as far as or what you should be expecting to experience if you are in a hospital and you know that physical therapists are coming in to see you. Oh, one other thing I do want to mention. Oftentimes, not often, I shouldn't say that, a lot of times, physical therapy may not be requested for a patient. I would, well, obviously, as a physical therapist, I would highly disagree with that. I think if you're in the hospital and you are having any decreased strength, any difficulty with movement, if you've had any heart issues, if you've had any respiratory issues, certainly if you've had any orthopedic issues, I would request that a physical therapist come to see me, to do an evaluation, and to help me get up and walk. Um, I've mentioned in a previous video that movement is life. It is critically important for you to get up and move, especially when you're not feeling like getting up and moving. It's as I mentioned, we are trying to prevent pneumonia. We are trying to get joints or prevent joints from stiffening up with early movement and early mobility. And you are just helping yourself a whole lot if you actually would request a physical therapist, even if your physician maybe doesn't have one planned as far as in their plan of care. But you, at the end of the day, it's your body, it's your life, and the physician will do what you request ultimately, at least for the most part. I mean, there are a few cases, there are a few exceptions there, and if you happen to fall under that exception, and a physician was not wanting to have you come in or have a physical therapist come in, then I would just have a heart to heart with them and find out, why that is. But in general, I would, in my mind, be expecting to see a physical therapist uh, no matter why I'm in the hospital. And as I said, let me add another caveat to that. As I mentioned, the orthopedic patients are a little bit different. You will pretty much always have a physical therapist assigned to you if you are doing any sort of orthopedic surgery, because those orthopedists understand and know the importance of early mobility and safety for patients, and the importance of getting those patients moving in a safe manner. So I hope that this has been knowledgeable for you, and that this will give you some good insight into what you can expect for your first physical therapy evaluation in an acute care hospital setting. All right, if you are in that setting right now, we'll be saying prayers for you, and hopefully, Lord willing, things will progress for you in a good direction very soon. All right. Well, thank you for listening, and check out my next channel, or my next video, which is going to be for those patients who are actually going on into a skilled nursing facility and what they can expect from their physical therapy appointments. All right, y'all have a good one.